Mr. Ramadan Assi, welcome to our forum today.
Thank you very much. Glad to be here.
It's our pleasure too. So you are the country director in Turkey of the NGO International Medical Corps. So in few minutes, please, could you give us a short description about your NGO?
Sure. International Medical Corps was established back in 1984 for the aim of, as a non-of-course governmental organization that aims to save lives, reduce suffering, and build self-reliance. And since then, IMC has been actively responding almost to every single major emergency since in the last 30 years. We managed to invest and utilize around $1.6 billion into health programs, working on the capacity and on the training of local health workers, dealing with the humanitarian needs for those societies. We describe ourselves as the first responder organization that keen to make sure we arrive immediately after any disaster. And more importantly, we also stay in the countries that go through emergencies after the disaster and after the media leave, because we also want to work with the community to build their resilience and to work on sustainable programs.
Good. So let's talk now about the nature of your work. So how do you work with the local community? In another word, so what are the main tasks in your area?
Well, International Medical Corps have a wide range of activity that we perform into our global programs. We, of course, a public health organization, we do a lot of health programs. We have quite a diversity of the programs from primary health care to mental health to water and sanitation. And also we do a lot of work and programs that design to build resilience and to mitigate risk and do risk reduction in communities globally. Now, for us, when we work with in any place, we do very much engage with the local community at different levels. Because they are the first responders. They are the first one who usually suffer through the crisis, and they are the first one who could actually, if they are well equipped with the training and with the proper skills, they can also mitigate and they reduce the amount of suffering and loss because of disaster. So we engage with the community at different levels. We work in most of the places we are working globally. We engage with the counterparts in the Ministry of Health and with local organizations who specialize in health programs. Equally important, we also work with community representatives. And one thing we always keen to make sure that we work with the local organization, because they are the backbone of the society. Local organization is something we care about, and we invest in their capacity, and we bring our global experience, and we give them the chance to be exposed to this experience, and we work together and collaboratively, so whatever we do is sustained in the community.
Do you have other partners throughout the world?
Absolutely. You know, our work without the major support we receive from our key donors and our partners, it wouldn't be possible. You know, we are one organization among a large consortium, or if you wish, it's a large pool of stakeholders that need to work together and to make the things happen. And from the donor side, you know, IMC is proudly working with the U.S. government and different bureaus within the State Department that are sponsoring our work globally. We also work with the British government, with UK Aid as a main second donor. We also work with the US government, Aid. We work with the EU. We also work with the different United Nations agencies. We work with UNHCR. We work with UNICEF, with so many different UN agencies that are relevant to our work, and you know, we have some common programs. But also more importantly, we also work with key private donors like Hilton Foundation, like Bill Gates, and many others. It's a big task, you know, what we do, and you need so much cooperation and collaboration with all of those people to make sure that you do your job right. And also in the, you know, keeping in mind the scarce and the lack of resources, you want to make sure that you don't duplicate your effort. You want to make sure that your effort is very well coordinated, that you are utilizing your resources in the most efficient and effective way in the service of those communities that you are working for. Therefore, we engage with all of our sister international organizations globally that are working with health or have cross-cutting programs with health.
So it's very interesting that you have really potential and interesting partners throughout the world. So my last question is about the refugees support. So how could you support the refugees throughout the world, and especially also in the Middle East?
Yes, I mean, whenever disasters happen, whether it's a man-made or it's a natural disaster, immediately you will see the community become whether a refugee or internally displaced, and therefore they are your first target to reach to them and work with them. We do certainly work with refugees all over the world. Every emergency and every disaster usually produce large number of refugees. So the way we work with those refugees is through making sure that we design our programs in a way that it reflects the manners and the norms in the community, that how they would like to be approached and how they would like international organizations to work with them. Therefore, we are, like I said before, we are keen to make sure that we work with local partners to make sure that we reach those refugees and we support them in the way that protect their dignity and answer all their essential needs, and to the level where they feel, getting all the major support. Now, the Middle East does have a special place within IMC programs, because we do have a large, although we have worked in more than 70 countries, we do have a large scale of operation that are taking place in the Middle East. We work very much in most of the countries that are having refugees as we speak. We